This is Irina Strunina, and this is our weekly podcast, Diabetically Speaking with SmartMove360, where we are talking about life and everything that is related to diabetes and life with diabetes. Let's go. All right. Hello again. Welcome back, those who are listening to us every week. And welcome the new people who just found us. This is Irina Strunina. Our podcast, Diabetically Speaking with SmartMove360, goes live every week on Thursdays at 4 p.m. Eastern Time. And we meet here with professionals, with healthcare professionals, with people who are on daily basis meet and help people with type 2 diabetes. And on the last Thursday of the month, we actually are meeting with people who are living with diabetes, who are facing this issue on a daily basis, and they are sharing their experiences. So if you are the one who would like to inspire others to share your challenges and how you overcome them, if you are a caregiver and together you reach that point when you already have something to share, please reach out to me and we will schedule you and interview you so you could inspire more people to take care of themselves. Okay? And today we have as a guest the person who actually lives close to me. We met on an event in our neighborhood that is also very health oriented. It's called Walk with the Dog. And my guest today is Sarah Omodele. She is a nurse and she is also well, Sarah, please introduce yourself. You have so many letters after your name, so please explain what they mean.
Sure. So I'm Sarah Omodele. I'm a nurse practitioner. I have my doctorate degree as a nurse practitioner, but also focused on lifestyle medicine. And I'm a family practice nurse practitioner. That was kind of my training. So I've had several years working with cardiac disease, patients with cardiovascular disease. I worked in a hospital and then a clinic. I've worked in gastroenterology clinic. I've worked in primary care and clinical research. So I've done quite a bit, but my passion has always been, the cardiovascular, cardiac care, and, how we can just prevent a lot of these illnesses, these chronic illnesses. So yeah, that's why. That's
Absolutely. Thank you, Sarah. And I'm so glad that you have this experience because so far we didn't have many guests who were focusing and had experience, like long experience working with cardiovascular disease. And I, as a certified nutritionist in cardiovascular and diabetes, this is something that those two diagnoses come together. This is why my education was given in those two diagnoses simultaneously. We were talking about nutrition part that is important to take care of for people with diabetes and for people with cardiovascular disease. And you have been working in this field long enough to share some of your experiences. And we always are talking that, unfortunately, as human and especially as women, we naturally tend to take care of others, take care of people around us, take care of the families, take care of the businesses that we're involved in, take care of animals, plants, everything, and putting taking care of ourselves on the back burner, kind of almost forgetting that we are also human that need care. And
Yes.
the one of the questions I want to hear your perspective on this, why the self-care is important for people with diabetes.
Yeah, that's a great question. I'm kind of, happy that you mentioned, especially for women, we take care of other people and we neglect our care. We are under a lot of stress, overwhelm, we gain weight, and we start living unhealthy lifestyle because we're just on the go, 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 and then voila, you develop diabetes. They find out, oh, now I'm diabetic, and that's another stress. So self care is really important. Like it cannot be overstated. Self care in terms of the most important thing is what are you eating? Our diet is huge. We don't realize how much diet affects everything. In terms of weight loss, for instance, you don't have to exercise to lose weight, but your diet is what makes you lose weight. So your diet is important for diabetic patient, and also in relation to the heart. You have to make sure that you watch foods that have a lot of cholesterol. You need to stay away from that. A lot of fat, greasy food, things that are fried, processed food, those things increase your blood sugar, increase inflammation in your body and your cells. And that's what leads to you developing blockages in your heart. You develop because diabetes is a macrovascular disease, so all your vessels and veins get affected. There's a lot of inflammation. There's a lot of, just buildup of plaque. And, it just affects all your vessels. So whatever you eat is very important. And then exercise. We don't exercise, enough. We need to exercise. We need to move. You don't have to go to the gym. You don't have to do anything too strenuous, but you just need to move, at least 20 to 30 minutes a day. Get up, walk around, go outside, get some fresh air. If the weather is not, conducive for you to do that, you can walk around in your house, go climb up down the stairs, stationary bikes and things like that. Squats while you're sitting, while you're standing, say if you work from home, doing some lunges, getting some cans to lift, you just have to be um, what's creative about it. If you really want to work hard on your body, you really want to improve your health, you have to stop making excuses, I say, because we will always make excuses. We are comfortable where we are. If you're comfortable, you're never going to get better. You have to push yourself out of your comfort zone. What can I do? How can I exercise? How can I make healthy food choices? And
Yeah.
also stress. Stress is huge.
Hold on, Sarah. You are giving us the whole list. Let's break it down a little bit,
Sure, sure.
because this is a lot to digest in one shot. So let's slow down a little bit. We I know you want to help, you want to share this, and I appreciate that, and that's why I'm glad that you agreed to be my guest today. So let's talk about this a little bit. You mentioned the food, and I can say that in our Facebook group, Diabetes 101 for Beginners, this is the number one topic of
Mm,
all conversations we have in the group, because it is important. You're absolutely correct. What we eat is important because we need fuel to live, to move around, to do the functions that we need to do, take care of the house, perform some work activities, to think. All this is important, so we need to feed our bodies. But what the fuel we put in our bodies is a
mhm.
different story. Just today I had a conversation with a friend of mine who is kind of questioning, is it that important? There is some other trick, she said. Food is not everything, but what do you think? The quality of food, how it affects, and please make the link between cardiovascular and diabetes, because those two diseases, they come together, unfortunately, very often. And I want to, for our listeners, to pay attention to this part as well. So food, cardiovascular, diabetes, why this is so important, why it is the what we are doing, how we are taking care of ourselves, feeding ourselves, is affecting the diabetes and heart.
Sure, that's a great question. So, say for instance, in terms of insulin, diabetes, but you're not being able to use insulin properly, so you need medications,
Hmm.
to either give you insulin or reduce its efficacy. So, the food that we eat, especially white processed food, they're very high in glycemic content, that's glycemic low. So there's just so much glucose and sugar. And remember, for a diabetic patient, you're not able to, move the insulin and glucose into the blood and things like that. So it stays in your in your bloodstream for a long period of time. And this causes a lot of problems. It causes a lot of inflammation. It causes a lot of some technical, I can't, I don't want to go into
Overwhelmed.
it.
Yeah, yes,
Yeah,
please use the
but
language that we
yeah,
understand.
yeah, but it causes a lot, and then it affects the vessels. And when the vessel is involved, the heart is involved. And then you're talking about having elevated cholesterol, your blood pressure is up, your cholesterol is up. And then you have all this plaque building up in your vessels, in your heart vessels. And then that causes, reduced circulation. And obviously, when there's a reduced circulation to the heart, because the heart itself is a muscle, so
Yes.
imagine, the heart has a lot of vessels, and the vessel itself, because it's an organ, needs its own blood supply. So when
Yes.
you have blockages in the heart, providing circulation to the heart, the heart is not getting what it needs. And so then you have, chest pain, shortness of breath, and then you
Mm,
have the risk of having a heart attack. And also you have the risk of getting a stroke, that's having circulatory issues in your brain. Once again, the blood vessels are what is really affected when it comes to diabetes. Your blood
yes.
vessels, anywhere that you get blood flow to, diabetes can cause problem in there. Your legs, you can have, some diseases, some peripheral
Neuropathy.
diseases.
Yeah.
Exactly. You can have a stroke, you can have heart attack. There's so many vascular problems. Even your eyes, people
Yes.
losing their vision because of diabetes. So when it comes to the heart, is really important because your heart is kind of like the core. You get your energy, you get your oxygen and everything. You need your heart. So it's important for you to make sure that your blood sugar is under control. Talk to your doctor, talk to your nutritionist, make healthy choices when it comes to your food. I know the food that we eat, the typical American diet is not the best. It's highly caloric, has a lot of salt, has a lot of fat, and it's very addictive. I mean, to be honest, it tastes good, and all those things taste good, and it makes you, it makes you crave it. And that's
Hmm.
what, not to go all technical, but the food industry, they know that. So
Yes. They
give you,
work on it.
yeah, they walk on it to the T. Like, oh, the chips needs to be a certain sound, a certain amount of salt, because it's very addictive. So you need to be careful. You need to watch what you're eating. A lot of fruits, a lot of vegetables, a lot of natural foods, protein, chicken, fish, beef, but lean, uh, not GMO. I know there's a lot of there's a lot of things out there that they're not clean. Lean meat, and don't eat a lot of protein because the American diet, typical food, you have a large piece of chicken and then you have this tiny little vegetable. If at all any vegetable. And that eating a lot of animal
Yeah.
products increases your cholesterol because they, those animals have their own cholesterol. So imagine you have your own cholesterol, they have their own cholesterol. Now you have all this cholesterol in you. And then high cholesterol leads to, heart disease, stroke, blockages. And, you just need to be mindful. Eat more
Oh
fruits and
yeah.
vegetables, eat more grains in their natural form, avoid processed food. Yeah.
Oh yeah. Yeah. Less processed food, that's for sure. And this recommendation that, I love it when people recommend, I mean, the professionals, when I hear this very simple ideas. First of all, don't go hungry grocery shopping,
Oh, yeah.
because when you're hungry, you are tending to make fast decisions on the spot, and that is not helping. You
Yes,
bring home so much food that otherwise you would not pick up if you were not hungry at the moment, right? Make a list and stick to the list,
exactly.
and primarily shop on the perimeter, right? These are three very simple tricks that help me, for example, to first of all, don't spend so much time grocery shopping. I go there with a list. I know exactly what those items are. I take it, and I go to the cashier desk. And I'm not shopping for hours. This is not my favorite way of exercises. I would much rather, with the saved time, go and walk around the block and get a little bit more walking outside, although it's hot right now, but
Yeah.
I can do that.
Yeah,
Yeah.
I totally agree with you having a list because if you just go to the grocery store hungry, you will just eat everything. And sometimes you go grocery shopping, you're so tired and you're like, you know what? I don't really want to buy, I don't want to, cook what I bought, then you go to the fast food, so to
Mhm.
stop that cycle from, starting before you go to the grocery store, don't go starving. Maybe eat like an apple or a pear or, crackers or something just to take the edge off. Then you
Yes.
go to the grocery store and then you can, spend time really looking at what you want and stick with it. And
Yeah.
one thing that's also important is in terms of having a lifestyle change and just sticking with with the dietary restrictions or self-care when it comes to diabetes, it just and also for general health, you need to have a why. Why do I want to be healthy? Why do I want to make sure that my diabetes is under control? Why do I want to do this? Because if it's just something that, oh, because my mom wants me to do it, or
Oh
because my
yeah.
wants me to do it, or because my doctor wants me to do it, it's not going to motivate you or keep you motivated when things get tough. You need to have like really deep rooted reason why you want to control your diabetes. I want to live long enough to see my grandkids. I want to be able to spend time with my grandkids. I want to be in my 50s and 60s and 70s and still be traveling and active. Very deep rooted reasons. So when you have that and you always remember, okay, why am I doing this again? Is because I want to do X, Y, and Z. I want to be able to move. I want to have energy. That will keep you grounded because trust me, it's tough, but you
Yeah.
need that anchor. Yeah. Yeah.
Yeah. Yeah. Absolutely. Absolutely. I've heard it once a long time ago, and now I'm always trying to repeat it. Our self healing starts here, in
Mhm.
those, how many inches, 6 inches between our ears. This is where the revolution happens. When we set up our minds, when we made those decisions, when we understand that this is for me, I will be the one who will enjoy playing with the grandchildren.
Yes.
I will be the one who will participate in those travel adventures. I will be the one who will see with my own eyes the different sites, and not the pictures that somebody else will show me, not the um, video that somebody else took for me, but me, myself, my own eyes, my personal emotions. I could touch it, I could laugh at it, I could enjoy it, smell, breathe. All this is the reason why I want to do that. And self taking care of myself, I am the one who wants to get it. I will take care of this.
Exactly, exactly. You have to be responsible. You have to take care of yourself. And as I say, your body is, you only have one body. You know,
Yes,
you're only here using this body for whatever time that you have the body for. So you need to take care of it because you can't replace it. You know,
yes,
my in my years of working in the hospital, I've seen so much, and that's what led me to getting my doctorate and doing lifestyle medicine. I've lost a lot of patients, dying from things that could have been prevented, and just because of our lifestyle, a lot of this diseases, diabetes, high blood pressure, obesity, all they're all lifestyle. And it's very important. You make that decision. What do I want to put in my mouth? Is this good? Is it going to benefit me? Is it nutritious? Am I active? Am I sleeping well? I mean, am I managing my stress well? Because all these things they're part of self-care. They're part of
absolutely.
self-care. Stress is
Def-
huge. Yeah, yeah.
Definitely. Yes. I always repeat that diabetes is often type 2 diabetes.
Mm-hmm.
Type 2
I see.
diabetes.
Yeah, yeah,
People some often are saying, "Oh, my family has this, and that's why I'm having this." And I have the other thought to consider. Is it because it's blood related, or because this is a tradition in your family? Maybe you all share love for the ice cream and you have, and every evening finish up your dinner with the ice cream. Well, maybe it's time to change this tradition, and instead of ice cream have a maybe piece of fruit or cup of tea, and enjoy the flavors that are coming with this natural product, right? People sometimes say, all our family has it, my grandfather has it, had it, my grandmother, my parents from, you know but maybe this is unfortunately, but we all coming from different cultures, different traditions, and in different traditions certain staple foods are the ones who not helping us, and we are loving it. It's our comfort food. We are loving it. We eat it every single time when we are stressed out, instead of
yeah.
um, maybe try to use the different ways to calm yourself down when you are stressed out. So
Right.
these are all self-care, mindfulness. I think it's very important. Oh, okay, Sarah, one tip. What would you recommend to people who just got this diagnosis? They got this phone call from the doctor's office. They in shock. They don't know what to do. There's so much information. There is so much to know, to do, to change. What would be your recommendation? How to start those changes? Just one simple thing people can do that will lead them to further steps towards the health.
Okay. The first thing is they should relax, calm down, because it's very stressful just knowing that you have diabetes. Um, what I would recommend is the first thing is what you're eating, your diet. As I said, that's
Okay.
80% of it. 80% of it is diet. Take a
All
look
right.
because sometimes we don't realize what we're eating. The only thing I'll say is take a look at what you're eating. Keep a
Yeah. Okay.
list. Yeah, just take a look. Write a list. Okay, for breakfast, without changing anything, the first thing is being aware. Without
Hmm.
changing anything, Write down what you eat breakfast, lunch, and dinner for like 1 to 2 days or 3 days. Just keep a log. And then you can start looking at, okay, this might be the problem, this might be the problem, and just replace those things with healthier options. That's the first thing you need to do.
That's a good recommendation. Not eliminate it completely, but replace it with the healthier option. Because sometimes we hear people saying, "I'm so tired of eating the same thing since
Mhm.
I got diagnosed." But there are so many different options out there. We do need to learn about it, of course, but that may help us to kind of like make the first step. Okay, I was drinking every morning the orange juice. What can I replace? Orange juice has just as much sugar as the Coca-Cola has, so
Mm.
probably shouldn't do it. Let's change it to something healthier that is not damaging my blood vessels, that is not damaging my liver, not damaging anything.
Right.
Well, let me tell you this, Sarah. We could talk for a long time, but
I
the
know, I
time that we had is over. We need to wrap up, and I wanted to ask you. Uh, we have listeners listening to us,
know.
and they might want to continue conversation with you. Where they can find you, what would be the best way for people to find you?
Sure. You can find me on Facebook. Yes, I think the link is up there. I post a lot. I'm actually a wellness coach. So I
Uh-huh.
help career driven women improve their health, mind, and body for more confidence and vibrancy. So I work one on one with women that just want to improve their health in a holistic way.
Okay.
Like we just don't focus on weight loss, we focus on everything: stress management, exercise, sleep, and self love. So those are things that are very important,
Of
especially
course.
for patients that have diabetes or pre-diabetes. Yeah.
Absolutely. Okay. Good. So anyone who wants to reach out to Sarah, find her on the Facebook. If you somehow forgot how to what's her name, how to spell her last name, reach out to me and I will connect you with her because
Sure.
I'm connected with her even on the personal level. Okay, so I wanted to share also, remind everyone a few pieces of information about our Facebook group. I wanted to remind you that on Mondays we have our Motivational Mondays little shows that help you to stay motivated. On Tuesdays, we have Telenurse Tuesday, where our registered nurses are going online and answer your questions that you might have. We have on Wednesdays, every other Wednesday, we have our support group meetings. We meet at 7 p.m. Eastern Time, and at this time, people come log in. It's off the Facebook, it's in Zoom. We meet in a room where we're discussing our problems, challenges. We support each other. We have victories to share. We have experiences to share. So join us there. Of course, every Thursday at 4 p.m. Eastern Time, we have our podcast, Diabetically Speaking with SmartMove360, where we invite healthcare professionals to talk with us about life with diabetes. And on Fridays, we have our Friday Fitness Fridays shows with Trevor Brown, where he is showing us different possibilities for exercises, how we can bring more movement in our lives, and how we can help ourselves to bring our muscles back to work. One very important announcement is that this month, last Saturday of June, June 29th, we will have our next 14th Diabetic Healthcare Expo. We will be sharing again different. information about life with diabetes, and we'll look at it from 360 degrees, and we will talk about the stress and lifestyle and support and family and self-care, uh, everything that we can help you with. We will be discussing there. We also will have a live demonstration, cooking demonstration for lunch and learn. um, I wanted to tell thank you to our sponsors, Mink Life Motivation, Unbalanced Entertainment, Life Based Solutions, and Empower People That Care for helping us to bring those shows and events to you. And with that, I wanted to say thank you again to Sarah for joining me today. And we will see everyone next Thursday at 4 p.m. Eastern Standard Time. Talk to you next week.
All right.